Hello and welcome to a brand new show of IRM. IRM is a show on which, with business leaders, we debate, ideate, discuss what needs to be done to bring India back on the growth map. We've had representations from almost all industry experts to talk about what their need of the industry is and how they feel the business which they represent has managed to come back in this entire COVID crisis. And it gives me great pleasure to bring on board Dr. Ashutosh Raghuvanshi, CEO of Fortis, to talk about what is happening to the private healthcare industry. And I just want to bring this point out for our viewers that Fortis, in a sense, has really championed this time our war with COVID. The number of patients they've treated, the number of doctors who've been always on the floor. Speaking out of personal experience, I can say that Fortis, in a sense, has really been, has taken the entire care and service phenomenon higher in this COVID crisis. Dr. Raghuvanshi, before we start our today's interaction and focus on numbers and pointers for shareholders, a big thank you to you, your team, your doctors and everybody in terms of an hospital staff for the relentless service you've done during these difficult times.
Thank you. Thank you. Thank you for your kind words. We have not only our group, but all the doctors, paramedical workers, nurses who have been working through this pandemic all across the world. I think it's time for the world to show gratitude to them. And I think it would not have been possible to fight without all of them.
Just to get the COVID part out of the way, Dr. Raghuvanshi, for Fortis Healthcare and the hospital chain which you represent, how many COVID patients have you treated and how many hospital beds currently are dedicated to the COVID crisis?
So through this crisis, we had designated 1,300 beds across our network with the possibility of increasing those numbers as and when required. We have so far managed close to about 32,000 patients across our network and with very gratifying results, with a very low mortality. And of course, there are morbidities and problems associated with the disease, but we are very, very satisfied that we were able to help that many patients.
When we spoke to you last, Dr. Raghuvanshi, we were focusing on how your Q2 performance had moved. And because of COVID crisis, there was a drop in your occupancy. Now that the pandemic is reducing, have things come back to normal for Fortis?
It is not absolutely normal. We still have some bits of work which is being contributed by the COVID. But I would say the non-COVID work has reached to the levels of about 85% of pre-COVID time. And partly that is because 10% of the revenue was earlier contributed by international patients. So as we all know that segment has been affected the most. So that is still lagging. However, as far as domestic business is concerned for non-COVID work, that is coming in certain hospitals almost close to the normal number. And some of our hospitals, about 5 of our hospitals in the network, have actually exceeded the corresponding month the previous financial year.
Your average occupancy before the COVID crisis was north of 70%. So can I safely assume that if not in this quarter, by next quarter, those occupancy levels will be back?
Yeah, so we are already at similar occupancy levels as pre-COVID time, which is approximately about 68 to 70%, varying in different hospitals. But that is partly being contributed by the COVID patients as well. So you're right that by the end of next quarter, we should expect a complete normalcy as far as occupancy is concerned, maybe even earlier.
There is a significant drop, Dr. Raghuvanshi, something which you also guided you along with your Q2 numbers in terms of manpower cost and savings have gone higher. How do you plan to utilize that? Would everything go towards debt reduction or are you likely to expand the margins also?
Yeah, no, see, there are two elements of the cost reduction, and primarily the major one which came from human resources was in terms of people taking voluntary salary cuts, the senior doctors and the senior managers. Now, that obviously needs to be reversed as the situation normalizes. However, we took this opportunity to make a lot of structural changes so that we could reduce our bill of both human resources as well as some other costs, like, for instance, marketing costs, sales costs, and many other costs in the maintenance side, etc. We were able to rationalize many of those costs. So some of that saving would remain. At the peak of the crisis, we were having a savings of about 25% of our fixed costs, which obviously will, to a large extent, get reversed. But some of them is here to stay. So that would definitely help on the profitability profile.
Dr. Raghuvanshi, if one looks at the COVID experience, there are a lot of permanent changes which have happened, and it is across the industry. In your industry, a big change which we can see is telemedicine, something which was unheard of, but something which now is normal practice. What are these permanent changes which do you think have happened in the healthcare industry and which could really significantly change the way you've done business in the past?
Yes. So, no, you're absolutely right. There were certain things which were staring in our face, but somehow the industry and the consumer behavior of the patient and the physician's delivery side as well was quite sort of resistant to making the change towards a digital shift. But as you know, that any industry today is moving more and more towards it, and it is going to be a way of life. So if everything else people are going to access digitally, why not healthcare? So there are parts of healthcare which do not require a physical interface, where the physician doesn't need to see the patient, they don't need to touch the patient, they only need to communicate, and they need to communicate effectively, and they need to also make sure that the information which is generated through such a transaction is available in the patient's life time in their episode of illness or once they recover. So I think digital technologies in healthcare were lagging in the delivery side for a long time. Telemedicine has been around for 20 years, but somehow the acceptance and the adoption was very low. So I think the pandemic has had some positive side of it. In this dark cloud, there was a silver lining where certain fault lines were very, very visible. And this was one of those examples where it became apparent to people that this is a viable option. And not only it is a viable option, it's more economical, it's more efficient. So a physician who would earlier have to see about 10 patients in an hour, and for that, if they have to go travel 2 hours to just reach some place and get back from there, I think that was a sheer waste of time. Now they are able to utilize that commute time also to see some more patients or do some other clinical work. So I think the efficiencies which are journey are important. In the initial stage, of course, there will be certain costs involved in creating the infrastructure on digital side, because I think it was ignored quite a bit and not sufficient investments were made earlier. So initially there would not be so much of a cost saving per se. But I think long term, it will bring in quite a bit of efficiency. And at the same time, it will make the patient's journey more satisfactory. So there is no doubt in my mind that digital is the way forward for at least the outpatient care and the follow-up of patients who have undergone procedures, people who have chronic diseases, who have to repeatedly go to consult doctors like diabetes or chronic heart failure, etc., or chronic renal disease. I mean, all those consultations, if they can move to a digital platform, it will be a great boon to the patients, and it will bring in a lot of efficiency.
So what does that mean for your business, Dr. Raghuvanshi? One is that it certainly means more business, as Now, doctors can attend calls all across India, even global calls. This also means that you don't have to create a large infrastructure, and you can serve and perhaps attend to patients which otherwise would have not come to your hospitals. Is this a big reboot? Could this potentially add 5, 10, 15% of top line in coming years?
Definitely. I think there is going to be just a shift. Existing patients only will move from one platform of being physical presence to a virtual platform. But gradually, this expands the constituency we can address. So especially second opinions, people from distant geographies who want opinion of specialists who are well known in their fields, all that adds additional business. Your estimate is right. Most players are expecting about 10 to 15% of benefit coming from digital platforms.
Are you also looking at expanding your expertise with other software companies, telecom companies? Are you looking at providing a bundled up services, perhaps with other app providers, or for that matter with medical companies? I'm just trying to understand that how are you taking innovation to a next step? I mean, today on my Apple Watch, I can pretty much get everything what I want. Do you think Fortis is looking at managing those tie-ups now?
Absolutely. The creating this entire ecosystem is not going to be possible by any organization, in my view. And this is going to go more towards a kind of ecosystem which will be created by multiple organizations and companies. Some may be pure technology plays, some may be delivering only part of the care, somebody may be just delivering medicine, somebody may be doing some other part of it. But that's how the ecosystem will be created. So it is important for all healthcare delivery providers, because hospitals typically have been only in the space of giving tertiary care, and that too acute care, where a patient requires some procedure, etc. So since we have expertise in doing only that, we cannot deliver, say, care at home as efficiently as we can do a brain surgery, for example. So we should focus on what we deliver best, but at the same time be a part of an ecosystem. So there is a continuum for patient. And that is why it is going to become very important that we form the right kind of alliances and collaborations. We work with many of these people, organizations, which other platforms which are being created. There are certain platforms of, say, pharmacy, for example, as you know. So it is important that we work with them. Of course, we'll have to be mindful that we should not, we should create the alliances in a manner that it is a kind of a win for both sides. And not necessarily cannibalizing one side of the business to the other.
One big contributor to your Q2 numbers was the diagnostic business, SRL. I'm looking at numbers, and SRL did nearly 5 million tests. Large part of that could also be RT-PCR and COVID. Now that vaccine is round the corner, the deep swell what we've seen in the diagnostic business, will that go away?
No, so diagnostic is slightly different dynamics, I would say. So we have so far done close to about 300,000 COVID tests. And we expect that the COVID tests are going to be performed in similar numbers as what we are doing today, or maybe even higher, for at least another 6 months or so. And then gradually this will become a business which will gradually go away, and it will become part of the routine tests. However, on the diagnostic side, the numbers have come down up to almost 95% of the pre-COVID levels.
If one works with the assumption, Dr. Raghuvanshi, that the vaccine distribution will start soon, what do you think that will mean for Fortis for after 6 months?
Yes. So vaccine distribution, and of course, is going to be controlled by the government authorities. However, they have given the guidelines as to how the vaccination centers have to be created, what kind of workforce is required, what kind of infrastructure is required. So we are preparing ourselves to be a part of that delivery process. So in whichever geographies we have our presence, I think we will be able to take this up at a very high scale. And that way we should be able to contribute in this journey. Now, what it would mean to a larger business would be that the normalization of the business will happen as people develop more confidence. And especially the international travel is likely to get eased as the vaccination numbers increase. And I think that would help us a lot.
A lot has changed at Fortis, Dr. Raghuvanshi. Professional management has taken over, cost cuttings have been initiated, leakages are getting fixed. I also understand that you are in middle of taking the next leap forward, which is in terms of a brand change. How far are you away from making that big change?
Yeah, so brand change is something which has been necessitated because of the brand agreement with the previous promoters. Fortis brand doesn't belong to the company. And hence, once this term gets expired, we will have to come up with a solution. Now, there are a lot of claimants for that brand, and there's a lot of legal complications around that. And that's precisely the reason why we thought that it is a right time for us to recast a new organization, a kind of a new paradigm and a new focus on generating trust amongst all the stakeholders, whether be it patient, whether our employees or anybody else.
Dr. Raghuvanshi, when I speak to some of your shareholders, the prominent names, and when I speak to analysts who track the hospitality sector, the first impression which they have is that healthcare spending in India will grow, hospitals will be bigger, but hospital companies may not make a lot of money because it's a fixed capital business and it's a business which requires capex. How will you ensure that Fortis remains asset light?
Yeah, so you're absolutely right. One of the things which is sort of again a side effect of this pandemic situation is that the weaknesses of the healthcare system have been exposed. And that one of the biggest issue in our country is the amount of resources available for healthcare, whether it be public sector or private sector. So private sector, the investments have been coming, but the investments have been low and the enthusiasm is not as much as it is for some other sectors. And the reason is very simple, because the profitability profile is very different in private healthcare. But overall pie, if it increases, if the spend on healthcare increases from the public sector and from the government side, that would definitely trigger a lot of investments coming in. So you're right, the hospitals would probably be on scale. Now, the reason why people feel that hospitals may be larger is because it is possible to process and deal with more patients with the fixed infrastructure. Say, for example, if you have an MRI machine and you have treating only 5 patients, obviously it is not cost effective. So the infrastructures have to be done in a way that they are optimally designed, so that all the equipment, everything is used optimally. And that in turn reduces the cost, and it improves the profitability profile of the organization. As far as Fortis is concerned, we have a lot of latent capacity available within our hospitals. So there are about 8 of our hospitals where large capacities can be created. So in order to make our hospitals even larger, we are going to first focus on that. And we have a plan layout of about 1,400 beds, which we are going to do in next 3 to 4 years. And some of that work we have already started. Now, in some of our hospitals, we already had some shell created where we can sort of, with minimal effort, take it to the next level. Similarly, the other places where new blocks have to be made, because the common infrastructure exists, the overall cost will be low. So, like, for example, a per bed cost, if we have to look at in a greenfield kind of project, it typically today is upwards of about 1 crore to 1.5, or even up to 2-3 crores, depending on what kind of finishes you do. But what we have estimated is that our 1,400 beds are approximately going to come at the cost of about 50 lakhs per bed, which is almost like, 1/3 of what typically would be the case in a greenfield hospital. So that is going to be one of our main focus on the growth element in the first stage. That doesn't mean that we will not look for opportunities outside of our network, but those opportunities again will have to be very much focused within these geographies, and they will have to come at a cost which is attractive. So there are multiple, developers and other, parts of the ecosystem, the real estate players, for example. Some of them may be interested in creating infrastructure so that can keep the cost down. So if there are projects like that in our core geographies, then that will be our second preference for growth. But the first one which we are focusing on is important because that is going to give us a pretty large capacity expansion. And at the same time, our cost of that expansion will be low. And at the bigger advantage is that because these are extensions of the existing hospitals, the period of kind of negative cash flows, which happens typically in a greenfield hospital, will not happen. So the moment these facilities are commissioned, it's an accretive business. So that's the strategy we are adopting.
Just to wrap it up with one last question. We are in 2020, which is FY21. I'm going to take the scale forward. The professional management has taken over a couple of quarters ago. Next 3 years, where do you think Fortis could be?
Yeah, so I think, we should be well past our legal issues of which we had. And I think that would be the one of the biggest things which we require. We have demonstrated in the last 1.5 years that operationally this is a strong company. Of course, our profitability profile can become much, much better. So we expect to be in next 3 years at least, if not twice, at least 1.5 times of what we were when we started this journey.
Well, Dr. Raghuvanshi, really appreciate your time. Thank you very much for joining us. And once again, on behalf of everyone from ET Now, thank you very much for the care and the kind of service your hospital, the doctors, the ward boys and the nurses have given us to keep all of us safe. Have a wonderful year ahead, and thank you for joining us.
Thank you for having me.